Good evening, Professor. Thanks very much for your time. I know that the researchers are all watching what the infections do. Are you seeing a climb in infections? Is there anything to worry about at this point?
Good evening to you. So I don't think there's much to worry about. In fact, the signs are fairly positive right now in that the total number of newly diagnosed cases is on the decline. But at the same time, there has been a reduction in terms of the number of tests that are being done. A more important measure is the positivity rate for those tests that are being done. At the peak of the outbreak, we were running a positivity rate of roughly about 27%, and that has now declined to 15%.
Sorry, you just broke up there. It's declined to what percent? From 27 to?
To roughly about 15%. So that basically tells us that there is reduction in terms of transmission in the community, and things seem to be stable, and we probably expect a further decline over the next few weeks, hopefully. We're wanting that figure to be less than 10%, so less than 10% of people that are symptomatic that come forward for testing should test positive, and that would indicate that there's fairly controlled control. There's a good amount of control in terms of the transmission of the virus in the community.
So good news, but absolutely no reason for complacency. We still don't have a vaccine. We're seeing lots of news coming through of various vaccines. I wonder if you could update us on how your vaccine trial at Wits is going. That's the Oxford one, and generally how close we are to a vaccine.
Yeah, so certainly this is not a time to be complacent, because if we start not adhering to the non-pharmaceutical interventions, start going to mass gatherings, we most certainly would see an escalation in terms of number of infections. With regard to the vaccine study, currently in the chimp at the Oxford University vaccine, we've enrolled roughly about 1,750 of the 2,000 participants, and now it's a matter of following those individuals up to get to a point where roughly about 42 of those individuals unfortunately need to develop COVID-19 before we're able to do an analysis to determine whether the vaccine actually protects against COVID-19 or not.
And, you know, one of the issues that is raising some concern, we've heard recently that there's a confirmed reinfection, the first one from Hong Kong. A man who developed the virus in March was actually quite sick, got better, tested negative, then went to Spain and got a slightly different strain of the virus, which suggests that immunity doesn't last forever. Just how worried are you about this? Because since that report, there have been a few others. Could this be rare, something not really to worry about, or is it something we really need to keep watch on?
Yeah, so Sally, actually is completely expected. It doesn't just go for the SARS coronavirus too. For many viruses, it's very common for people to be reinfected multiple times. The important thing is that after your first infection, you develop a good amount of immunity, and even though you are re-exposed and you become reinfected, the subsequent infections almost invariably are going to be milder. And in fact, in many instances, it will be completely asymptomatic. The case that you're referring to is a classical example where the individual had severe illness the first time around, but upon reinfection, the individual actually had very mild illness. And that is pretty much what we can expect. I would be surprised if people do not become reinfected, but the reinfections generally will be milder and probably in most instances are completely asymptomatic. People won't even know that they have been reinfected.
Well, that's certainly some reassurance. Thank you very much, Professor Shabir Madh, Professor of Vaccinology and a member of the Ministerial Advisory Committee on COVID-19.